Hi guys, it's Peyton again. Today I'm going to talk you through and show you how to perform nasopharyngeal suctioning, and we're going to use the sterile technique. Of course, you're going to go into the patient's room, you're going to explain to them what you're about to do, introduce yourself, answer any questions they may have about the procedure. You're going to perform your hand hygiene. You're going to position your patient into a high Fowler's or a semi-Fowler's position. And then when you do perform this procedure, you're going to kind of have them hyperextend their neck a little bit. So after that, we're going to gather our supplies, which we're going to need our suction catheter kit, which I already have my catheter out. And in this kit is going to be your sterile gloves, which I already have on, but I'll explain that as we go through. And also in this kit is going to come a little basin. That's where we're going to put our sterile water. And then, of course, we're going to need our linen saver pad, which we've already placed on the patient. We're going to need our PPE, like our gown, face shield, and goggles, just in case any secretions were to come out and get onto you. We are going to need our sterile water that we can place into this basin. And then we're going to need some water-soluble lubricant to lubricate the end of this before we section. So after we've gathered everything, we're going to go ahead and I've already done this, but we're going to go ahead and place the linen saver pad over the patient. We're going to put our gown on, our face shield, and our goggles on to protect ourselves. We're then going to turn on the wall suction or the portable suction machine, whichever you have. You're going to set this at a certain setting. For adults, it's going to be 100 to 150, and then for children, it's going to be 100 to 120. So after we do that, we have it set, we're going to test the suction equipment. We're going to kind of like occlude the tubing. This will show us if it's working or if it's not working. So after we've done all of that, we have all of our equipment on. We're going to open our suction catheter kit. And like I said before, in here is going to be our sterile gloves. So once we open that, I'm going to don my sterile gloves. And once I do that, my dominant hand, which is my right hand, is going to be my sterile hand. And then my non-dominant hand, which is my left hand, is going to be my non-sterile hand. So once we have our gloves on and everything, we're going to set up the rest of the equipment in the suction catheter kit. I'm going to use my non-dominant hand and set up my little basin that we have. I'm then going to pour that sterile water into that basin. And so the outside of that basin now is non-sterile, and then the inside is still sterile. So once I have that all set up and ready to go, I'm going to get my suction catheter out of the kit, and I'm going to grab towards the end of this with my sterile hand. That way we keep everything sterile at the end of this. And then grab the other end with my non-sterile hand. So this is the end that I'm going to suction with, and then the one that I'm going to apply the suction with. You're going to apply your finger over this hole, and that's going to cause this to suction. So once I have my catheter in my hands, I'm going to measure how far we're going to insert this. So keep in mind that you're going to keep this sterile while you're doing this. So you're going to measure from the tip of your nose to your earlobe. And once you get that, you're going to mark that, and that's going to be about how far you're going to insert your suction device. For nasopharyngeal, it's normally about 3 to 4 inches. And then, so once we have that measured, we are going to get some of our sterile water in the tubing to kind of lubricate it. So we're going to stick it in there, our little basin, and apply our thumb to this little hole and suction some water, a little bit of water, to kind of lubricate this. And then we're going to use our water-soluble lubricant, and we're going to apply it to the end of this to kind of ensure that it goes down easier. So once we have done that, we are going to go ahead and suction the patient. So we're going to kind of have them hyperextend their neck a little bit, kind of have them hold their breath, and we're going to insert this quickly but gently. So you're going to insert, 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 and you may get some resistance. If you do get some resistance, you do not want to force this, so you may need to switch to the other side of the nose. So once we keep advancing this, and we get to where we marked, we're going to apply our suctioning when we are removing this. So I'm going to place my hand over the end of this and pull out, and we're going to rotate this tubing. This ensures that there's not going to be any trauma to the nose. So once we do that, we've removed that, and we need to suction again. Say we're going to clear this out, we're going to suction a little bit of our sterile water again. And when you are suctioning, you want to limit that suctioning to about 10 to 15 seconds. You don't want to do it any more than that while you're doing a single suctioning. And then after you do it once and say you need to do it again, you want to at least give the patient about a 20-second break. That way they can gather themselves and kind of catch their breath. So say, I need to do this again. We're going to, like I said, we're going to suction a little bit of our sterile water to kind of clear this tubing up and lubricate it a little bit better. And then we're going to insert, insert, insert to where we marked. And then we're going to apply our suctioning and rotate this tubing and remove it. And then, of course, once we get finished with this, we are going to kind of coil it in the sterile hand and take our gloves off. And then we're going to get rid of it in a biohazard bag. So we're going to throw that away. And then you're finished with your suctioning. You're going to ask the patient if they're doing okay. You're going to position them for comfort. And then you're going to provide mouth care too, just in case any of those extra secretions got in the mouth. And then also, I know I didn't show you any kind of other suctioning. For, say we're doing nasotracheal suctioning, you're going to measure from the nose to the earlobe to the bottom of the neck. And that's going to be a total of about 8 inches that's going to be how much you're going to insert your suction tubing. And then for oropharyngeal, you're going to measure from your mouth to your earlobe. And this is going to be also about 3 to 4 inches. And for trachs, you can't really pre-measure. I mean, in adults, you don't want to go more than about 6 inches down. And that's pretty much it. Thank you guys for watching.